Pharmacists are healthcare professionals with expertise in medication. They play a critical role in ensuring patient safety and optimizing medication use. Their knowledge base encompasses a wide range of areas including pharmacology, pharmacokinetics, and pharmaceutical chemistry. Pharmacists are responsible for dispensing medications, counseling patients on their proper use, and monitoring for potential drug interactions. Pharmacists are employed in various settings. These settings include community pharmacies, hospitals, clinics, and pharmaceutical companies. They interact directly with patients, providing medication counseling and answering questions. Pharmacists also collaborate with other healthcare professionals, such as physicians and nurses, to ensure optimal patient care. The role of a pharmacist extends beyond dispensing medications. They also play a vital role in disease prevention, health promotion, and medication therapy management. Pharmacists can provide immunizations, conduct health screenings, and offer smoking cessation counseling. Their expertise in medication therapy management helps patients optimize their medication regimens and minimize adverse effects. In essence, pharmacists are essential members of the healthcare team. They ensure the safe and effective use of medications to improve patient outcomes. Their vast knowledge and skills make them indispensable in today's complex healthcare landscape. The journey to becoming a pharmacist typically involves a combination of rigorous academic study and practical experience. While specific requirements may vary across countries, the fundamental principles remain consistent. Aspiring pharmacists embark on a path that equips them with the necessary knowledge, skills, and ethical grounding to excel in this demanding profession. The first step usually involves obtaining a university degree in pharmacy. This comprehensive program provides a solid foundation in pharmaceutical sciences encompassing subjects like pharmacology, pharmaceutics, and medicinal chemistry. Students gain a deep understanding of drug mechanisms, dosage forms, and therapeutic applications. Practical experience is an integral part of pharmacy education. Pharmacy students engage in internships or clerkships at various healthcare settings, including community pharmacies, hospitals, and research laboratories. These hands-on experiences allow them to apply their theoretical knowledge and develop essential skills under the guidance of experienced pharmacists. Upon completing their academic and practical training, aspiring pharmacists must obtain licensure to practice. Licensure requirements vary by country but generally involve passing a series of rigorous examinations that assess their knowledge, skills, and competency. This ensures that only qualified individuals can practice pharmacy and provide safe and effective care to patients. The path to becoming a pharmacist is challenging, yet rewarding. It requires dedication, hard work, and a genuine passion for improving patient health. By adhering to ethical principles and continuously expanding their knowledge, pharmacists play a vital role in shaping the future of healthcare. Germany, renowned for its exceptional healthcare system, offers a well-structured pathway for aspiring pharmacists. The German pharmacy education system is highly regarded internationally, attracting students from all over the world. Let's delve into the step-by-step process of becoming a pharmacist in Germany. First, obtain your higher education entrance qualification, known as Hochschulzugangsberechtigung or HZB. To study pharmacy in Germany, you'll need a qualification equivalent to the German Abitur. International students may need to have their qualifications assessed for equivalency. Next, apply for a pharmacy degree program known as Staatsexamen. German pharmacy education follows a state-regulated curriculum leading to the Staatsexamen degree. This program typically lasts 5 years, divided into 2 phases. Complete the first phase of study, or Grundstudium, which is a 2-year phase covering fundamental sciences like chemistry, biology, physics, and mathematics, laying the groundwork for pharmaceutical studies. Then progress to the second phase, or Hauptstudium. This 3-year phase delves into specialized pharmaceutical subjects like pharmacology, pharmaceutics, pharmaceutical technology, toxicology, and clinical pharmacy. Undertake a practical year known as Praktisches Jahr. After completing the Hauptstudium, students undergo a 1-year paid internship at various pharmaceutical settings, gaining practical experience in community pharmacies, hospitals, and the pharmaceutical industry. Pass the first pharmacy state examination, or Erster Abschnitt der pharmazeutischen Prüfung. This comprehensive exam assesses the knowledge and skills acquired during the first 5 years of study. Complete a 1-year practical training, known as Pharmazeutisches Jahr. Following the first state exam, graduates undertake a paid practical training year, focusing on applying their knowledge and developing professional skills under supervision. Pass the second pharmacy state examination or Zweiter Abschnitt der pharmazeutischen Prüfung. This final exam evaluates practical skills and knowledge gained during practical training. Apply for your approbation, which is the license to practice. Upon successfully passing both state exams, graduates can apply for their approbation from the relevant regional authorities. Finally, begin your career as a licensed pharmacist. With your approbation, you are officially qualified to practice as a pharmacist in Germany. Germany welcomes international students with open arms, and the field of pharmacy is no exception. Numerous universities across the country offer pharmacy programs taught in English or German, catering to a diverse student body. However, international students must navigate specific requirements and procedures to pursue their pharmaceutical aspirations in Germany. Language proficiency is crucial for studying pharmacy in Germany. Most pharmacy programs are taught in German, requiring international students to demonstrate their language skills through recognized exams like the Test DF or DSH. Some universities offer pharmacy programs taught in English, particularly at the master's level. These programs usually require proof of English language proficiency through tests like IELTS or TOEFL. International students from non-EU/EEA countries typically need a student visa to study in Germany. The visa application process requires submitting various documents including a valid passport, proof of admission to a German university, proof of financial resources and health insurance. The application process for international students may vary slightly depending on the university and program. Generally, it involves submitting an online application form, along with supporting documents like academic transcripts, language proficiency certificates, and letters of recommendation. Some universities may also require applicants to pass an entrance examination or interview. International students must ensure that their previous academic qualifications are recognized in Germany. The recognition process involves submitting official transcripts and certificates to the designated authorities for evaluation. Studying in Germany involves various expenses, including tuition fees, living costs, health insurance, and visa fees. International students should carefully plan their finances and explore potential scholarship opportunities or part-time work options.